take objection to the word fixated. Anyway, okay, so does anybody have any questions about this part, about the,
No, it's
Expendable
just,
trust
again,
funds.
we need to look at the heavy equipment one for next year
mm-hmm,
and come up with some kind of number to realistic number to put in there, depending our,
well, and I think that's where we need input from the DPW.
DPW, because we need to start putting some money in there for the next.
I don't think this committee wants to start dictating how much people are gonna budget in their
No, I know,
budgets.
but it's 10,000 isn't close to
Well, it'd be
covering
nice
what
to
we're gonna
have
need.
a third of the cost of something.
That's what I
saved
mean,
up.
a more realistic number,
Right.
you know. Yeah.
And so currently, there's the highway heavy, and then the transfer station has a capital projects
Right.
fund, but there's no overall capital improvement plan or fund or anything. Okay, okay. Things are
No,
just,
the highway guys have, in the CIP, they have stuff listed. And they have $90,000 for 2024, 158, and then 158, 146, 103, 103, 71, 34. There's numbers in there for them with regard to budgeting it.
so I wonder if that gets rolled into budget, because it's not going into the highway heavy equipment ETF for $10,000.
I think that's Ned's spreadsheet, and it was never really like analyzed by.
Yeah, I think Ned would update it and try to, build it out, but
But it didn't translate into getting put into the budget or
No, I don't
warrant
think so.
articles or anything?
Yeah,
Okay.
that's my understanding.
More
Alright.
like a worksheet kind of idea, because the
Okay.
selectmen never really, I don't believe the selectmen ever said like run with it or anything.
Okay. Well, that's what we're gonna do now. Okay.
Okay.
How many revolving funds are there?
One, I think.
All right.
Will that be tracked?
The treasurer tracks that one in her report. That's her,
Okay.
she has control of that, is responsible for that fund.
Okay.
How often do you get an update to that? Quarterly?
No, there isn't like a physical balance given, like, no.
It's like whenever rec has asked for it, it's been available.
Oh, sure, we'll
Yeah.
we'll give it out anytime, but
Yeah.
there's not like a quarterly report that says what's in every account in the town kind of a thing. Do you know what I mean?
Yeah, but the RTF, the balance is in QuickBooks or in something, you
Oh,
guys
yeah.
are able to produce that.
Easy enough to pop out if
Yeah.
someone said what's in there right now.
Because that's just the rec one is the only one, it sounds like. And then what reports are under, then what accounts, this is what I'm trying to wrap my head around, and I need to figure it out as a selectman, is what falls under the trustees, what falls under budget, what falls under
Right.
treasurer, and what,
Well-
like, who's the agents to expend what, and all,
So we'll-
every last thing.
So an expendable trust fund, basically 99 times out of 100, I know DRA now makes you say in that who the agent to expend is.
Yeah,
In the
Um,
warrant article to create
In the
it
warrant
or-
article when you create it. Capital reserve fund, no question, only town meeting can decide to spend any money out of that. The other accounts, if you look in the town report under, for the treasurer's report, it lists the things that she's in charge of.
okay,
That she maintains for us, like the conservation accounts, like the land use change tax account, the rec account,
Okay.
what else is in there? Yeah, conservation forest maintenance account, the police department account, the PEG TV account. So.
okay, so those are under the treasurer.
Mhm.
And then trustees, we have the trustees, and
Yeah.
then,
Trustees are
Recreation.
expendable trust funds.
Says it
and
was
that kind of-
closed.
yeah. And then some ETFs, there are still, there's some that selectmen are agents to expend and others that are other.
9 times out of 10, it's the selectmen are the agents to expend.
Yeah,
Yeah.
Um,
Are there any left that, I know there was a whole, not issue, there was a discussion about when we were moving between forest and land conservation and some of those things, that the conservation committee was a agent to expend, and now.
Right, and that, well, that's for the land use change tax. That
Okay.
statutorily, according to, that's how that operates. That's in the Conservation Commission can spend that money without the permission of the selectmen or anything like that, as long as it doesn't have to do with the purchase of a piece of land.
Okay,
That would require the approval of the selectmen. Then they have they have a gift, I think do they still have the gift account? They have a gift account, they've got their forest maintenance account,
Yeah.
which is a little different.
Kate shared a document that had the 4
Right, that
accounts
thing
and
that,
who were the agents. I'll see if I have that.
Cordell wrote that,
Oh, okay.
that explained how all those funds are supposed to be handled.
okay. Anything else?
I don't think so.
Anyone else? No? If not, then we'll move on to the other business, which is the health insurance.
And it's, we touched on it with the selectmen, last Tuesday night. I wanted to kind of give them an idea. So-
Thanks for sending that out, so we can at least look at some of the options and costs and.
So this first green and yellow sheet is strictly health trust numbers. So the yellow on the top this year, that is what we had for expenses for health insurance with that particular plan. This year, if we had had the green plan below it, which has a little higher of a copay and a significant increase in the deductible, that's how much that we would have paid in insurance with a difference of $100,000. That's staying within health trust.
Who's the insurer?
Health trust.
Anthem.
Oh, Anthem.
It's
Anthem.
Anthem? Okay, that was one of my questions.
Yep.
And, how, in general, I guess, I assume you're under the Anthem plan. How is that received by the employees? Is it a good plan? Are people happy with it and stuff? Okay.
As
No, I'm
far as
just
I know,
trying to-
there's nobody has any issues.
Okay,
Right now, and I would expect right now, we have an HRA that pays for half of the employees' the first half of the employee's deductible. And that happened a couple of years ago when we went from a higher plan down to one with a higher deductible. With that, we changed it, and so that we created the HRA. I think that was in 2019, we created the HRA so that we could cover half of the deductible and go to a lower premium plan, and not impact the employees so much right off the bat. And it's worked out terrific, because I think that was a last spreadsheet in here that kind of showed the HRA's 2019 year-to-date. So over the last 5 years, we've only spent $18,000 in covering deductibles, which is a whole lot less
then
than
paying the premiums.
premium on the
yes.
high, right?
No, that's a good idea.
And for the most part, when you think about it, we got a pretty healthy group.
Health, I was gonna
No,
say.
yeah, I was gonna say, you're not
Because
many
no one's
claims.
really meeting,
Yeah.
nobody's really meeting their deductible unless it's some crazy thing, but and altogether, you gotta figure that's everybody's families too, in that, not just the employees that are
Right.
taking it, so.
Yeah.
So working that way has worked out well so far. The second set of numbers here is a very similar. We don't have next year's numbers yet. We won't have them until mid-October. But anticipating the change in who would be getting insurance next year, still using, so basically just the number of people being insured changed. You're still saving a significant amount of money by changing plans within the same company. So that's kind of just an overview.
What was the difference in the deductibles? It's probably in here.
Yeah, it is. So right now we have $1,000 and $3,000,
Yeah.
and the other plan has $3,000 and $9,000.
Okay, no, it's significantly different.
The copay goes from 15 to 25, which personally being on the insurance, I don't think that's that, 25 isn't that bad.
I mean,
15's
that's what I
great,
think a lot of us pay
25
when
is
we go to the
typical, I don't think
doctor.
that's
I pay
unusual.
that, yeah.
Yeah.
Dollars or percent?
Dollar, 20, yeah.
No, when you go to.
Just making
$25
sure.
go to her.
Yeah,
Right.
no,
Visit.
I
Yeah.
say,
Yeah.
that's what I pay, like 25.
And one of the other, most of the things, preventative care, you know, like your annual physical and, mammograms, that kind of stuff, there's no
Still
charge
free.
at all,
Yeah.
it's all, so that carries over to the larger plan, but some of the things, like, I know this is really hard to read, durable medical equipment and MRIs and blood work and those kind of things, they call it, you pay nothing if you go to site of service. So that means that if you go to one of those urgent care
LabCorp
places or Quest or something like
Something like
that
that.
and have it done versus just being at the doctor's office and having it done, there's no charge if you go to that Quest diagnostic place, but if you have it done at the doctor's office, it comes out of your deductible.
Do we have any of those places in town?
Saco River has a Quest,
Yeah, they
so
are.
they charge
So,
directly.
I mean, it will take a little bit of research for us to send everybody to the right place, but
Right.
it's doable. It's not, and even just the same, even if it was part of your deductible, if you
No.
didn't want to do it, you know, that's entirely up to you how you want to work it, but
True.
So when we say we pay 50% of an employee's deductible, is that
the
like
first half.
they have to, okay, so it's
It's
first
what'd you
half.
say?
Yeah, and that's,
Okay.
and the law is written that way. The most
Yeah.
you can pay is the first half
Half.
of someone's deductible.
Okay.
This is all Anthem, right?
Yes.
Have you looked at the other programs?
Can we stick to Anthem for a minute? No, I ran some numbers.
The
and-
Harvard program, I know that the Health Trust has.
I worked for them a long time ago.
Harvard program?
Yep.
They're excellent.
I was basically like a
I
group
don't get
accounts
it.
coordinator
Probably.
where I would be your contact.
What I
Oh,
did,
yeah, yeah.
What I did, Linda, for next year, since the new rates aren't known until October, November, I used the 6% inflation that I looked up last year when I kind of put that health insurance plan. And with the addition of, you know, we're adding additional people going on to family plan, that kind of stuff. If we add 6%, the total cost for the yellow plan, I'll call it the yellow plan,
Right.
comes up to $396,729 for, this would be for
With the
2025.
Right, with the 6%.
And that's a 20.5% increase over this year. And the green plan would be the same. We'd be looking at 269,912. That's with a 6% inflation factor, which it may be higher, but you know, health insurance tends to exceed the rate of
Right,
inflation.
except for tuition. That's the only other thing that outpaces
Yeah,
it.
so it's still about a 20.5% budget increase. You know, that's what we're looking at next year, pending, you know, what the new rates are. So just to be aware that if we go yellow or green, you know, we're looking, you know, at the rates going up, our costs, because again, it's just not inflation. We're adding, it looks like a single person, there's more people under the family plan, you know, that kind of thing.
Even just the same, if you did the green plan next year,
Yeah,
you're still
Even with your
less
6
than this year,
right.
and on the yellow plan.
we'd still be, yeah, our cost next year on the green plan for the anticipated number of people would be 269,912.
Which, when I did the math, is $126,000 savings over what the yellow plan would be.
Yeah, that's what I mean, so,
Given your 6% increase.
I mean, that's just a guess,
Yeah.
a wag, right? You know. But that seems to be the trend, you know, health insurance is going up 6-8% a year, the premium cost.
Right.
And one of the, I know we discussed this last year, and I'm just trying to get in, think about it. I'm not sure how much of an impact would actually be. You know, I looked at the national average for what local and state employees pay as a percentage of the premium cost. I believe it was about 13%
Yep.
nationwide.
13 point something.
Something,
So
almost-
between 13
yeah.
and 14%.
And our employees pay 5%. But you know, in the overall scheme, it really doesn't have an impact on a $396,000, you know, total cost. But I don't know, you know, if the selectmen would decide to raise that to, you know, 7-8% or something. I'd have to run the numbers. I don't have a
Can you do that for me?
Yeah, just, you know,
Just,
what it would
like-
actually, what
Right.
would be the impact?
So the 5% currently, then if it went to 7%, if it went to 10%, and if it went to 13%. I don't know that anybody on this committee necessarily, I'm voicing my own opinion, I
Yeah.
shouldn't say, would recommend in a single year it go into a 13%.
No,
but-
no, I don't
That
wanna
would
apply that to
Right.
anybody.
No, right.
And, no, I'm just kinda looking at the numbers going, you know, in the overall scheme, it, you know, if we did go to 7-8%, would it, you know,
Would it make a
would
significant
it make a
impact?
significant difference? And based on what I see here, probably not, but we'll have to look at. the
Yeah,
numbers.
I think having the numbers and
Yeah.
saying, no, it only makes a $3,000
Dollar
difference.
difference, and
And
is
it's
it
not
worth
worth
it? It's not
angering
worth it.
and making people really upset.
That's
and-
my concern, I don't
Yeah.
wanna
But-
upset people.
But at the same time, if you went from yellow to green, increased to 7%, the employee's portion might still be the same.
That's
See
what
what
I'm
I'm saying?
thinking,
Yeah,
yeah,
so-
that's what we,
Right, it might-
I haven't
they
dug
might
that
not-
deep in the numbers.
Right, so it might go from
No.
438 to the 643 kind of thing.
Back to what, they'd still be paying the same amount,
Right,
essentially.
You
so
know,
out-of-pocket expenses wouldn't
Right.
necessarily,
that's my concern, what's the impact on the employee, you know?
on their
what-
paycheck,
On their paycheck and
Right.
their out-of-pocket expenses.
right.
So, you know, we have to be careful, I wanna make sure we understand the impact.
Can you do me a favor, Linda, would you send Joe this spreadsheet? Or is this just like is this a spreadsheet or is this
Yeah,
just
yeah, I
Just a
think
table or
Or is
something.
it just a
I think
table?
in a
Then he can
spreadsheet.
add other columns in it. And we can see, he can add, or
That-
different tabs that show employee 7% town portion.
Would that help, Joe?
Yeah, no, that's it, I haven't had time to dig through
Yeah,
the
no, no,
numbers,
right.
you know, and just kind of what our value is. I mean, based on Linda's work, there's significant cost savings from going from yellow to green.
Right, there's $126,000.
My concern is, what is the impact on our employees as well? You know, how many people are, as Linda mentioned, we have a very healthy group of employees that are
Right.
not, based on the 50% deductible reimbursement, we're not spending a lot of money on that, so I don't know. Would it significantly impact our people? I don't know.
Well, and that's where I think having
Yeah.
the numbers laid out so you can look at it and see it and make a rational decision about it. Maybe the decision is, you know what, it's not worth it to make the change at all.
That's what
rather than-
that's what I'm
rather
kind of
than-
leaning toward, but
But,
These plans also include prescription coverage?
Yes. Yep, and I think, there's a little number here. It's on the other sheet. But yes, they do include prescription.
no, because, I mean, when we compare the budgets, we're gonna see, a 20.5% increase for insurance compared to last year. And again, that includes additional employees
Right.
and a 6% increase in
Okay.
inflation.
But you also have to think
So-
about the people that are paying the bill. I agree with the employee thing, but think about the people that are paying the bill. We're a retirement community.
No, I agree.
We have a lot of people living on real fixed incomes. You encounter that all the time. And someone who's on Social Security pays right now 170,
I'm
almost
72, I think.
$174.75 a month. So if you have a two-person household, that's times two. You don't have, that's only covers 80%.
That's just Medicare A or B or whatever it is, yeah.
And if you want to cover the other 20%, you gotta get a supplemental plan that's several $100s, $500-$600 a month.
Mhm.
And if you want prescription coverage, there's another $95-$96. And that takes you quickly into the donut hole where you'll start out at the beginning of the year getting your generics for free, you're getting a reduced price for the designer drugs, and the designer drugs are all over TV,
Mhm.
and they're not cheap. So what they do is they take you into this next level, we call it the donut hole. It's a coverage gap, and right now it's I think $5,030 to get to the coverage gap. Once you get there, you have to spend $8,000 in order to get to catastrophic coverage. I mean, you'll be bankrupt by the time you get there.
By the time you get
So,
there,
I
yeah.
guess my question
And
is,
the way you get you
what-
to get you to the donut hole is you'll start out the beginning of the year, let's say you get a drug, if you buy it even on a 90-day supply, you get a 90-day supply for $125. That drug, the retail value of that drug may be $2,500.
Mm-hmm.
That gets applied to the number toward the 5,000, not what you pay. And once you get to that donut hole, then you're paying 25% of both.
Oh,
The
geez.
generics
Yeah.
and you. So, think about this. You have people in the community, I'm sure I know 2 or 3, who are living on Social Security, who are getting hammered. They get an increase. The increase in Social Security income, on average, has been about 2% over the last
Several years. at
20
least.
years. And there have been a couple of years in there where they jacked in an 8, they jacked in a 5, but and then almost nothing. So it's around 2.5% a year. Every time they get that increase, they also get an increase in the cost of Medicare,
Oh, yeah.
prescription drugs. So that gets chipped away.
Well, it sets them back like 4 or 5%.
Oh, let
Oh,
me tell
yeah.
you.
At least. So, but
And-
we don't have anybody in town as our employees that are in that
I'm
situation.
not talking about employees. I'm talking about the people paying the bill.
The taxpayers.
Right, but I
That's
guess,
why we're here.
well, the point is then, anything we can do, those things that we can do to reduce that overall cost to them, to the taxpayer, I think is worthy of looking at, and that's why we asked for this health insurance comparison, because the bill to the taxpayer continues to go up.
Linda, how much would you, I think I did that wrong. If, I'm kind of going off, if we had 5 employees, 5 were single, 5 were 2, 5 were family. I don't know, do we have one that's more than the other? Like,
Oh, you mean like a category that's more like we have
like
more-
employees, or do we have more employees?
We have more
on the-
family plans than, right now, we have no, right now, we have no singles.
Okay.
So we have 2 persons and family.
Yeah, and I wanna say there's 11 altogether, and I wanna say it's 4 and 7. 4 single, 4 double and 7 family.
Okay, that gives me some numbers,
I wanna say.
okay.
Can I finish this?
Mm-hmm.
So,
You see,
Let him
If-
finish. Wait, sorry, let him finish.
sorry, go ahead, yep, sorry.
the Senior Citizen League did a study for Social Security from 2000 to 2023. They took a market basket of goods that retirees use. They're different than others, obviously. They have other costs that some people don't incur. They took that market basket of goods and they compared it with 2023. Between 2000 and 2023, Social Security went up 78%.
Mm-hmm.
The cost of that market basket of goods that they take went up 141%,
Mm-hmm.
double. The end result is that people on Social Security have lost 36% of their purchasing power. So when we're talking about this, you have to keep that in the back of your mind. There are people out there that are hurting.
No, I know, I see it all the time.
Well, you should.
Yeah.
You do.
I do, I see them at the
I-
pantry all the time.
I appreciate
Yeah.
that. I mean, it's a difficult to see some of
As
these
we
people
spoke
that-
earlier, by the middle of the month, they're out of the
And-
social security money.
And I know that we can't solve everybody's problem, but damn, we can mitigate some of these costs.
Mhm.
And I think we have an obligation to do that, so
Okay,
that's it for now.
so if we have, current employees are currently at 5%, 4 single, or excuse me, 4,
2
2,
person and
7,
7
yeah.
family.
The total cost to the town of the green plan for next year at 5% is 1.5 million. And 7%, it's 1.492, so it's a
Wait.
savings of.
Where are you
Where-
getting $1 million
Yeah.
from? Yeah.
Because if we have, so that's the town portion for an individual on the single plan.
So what
Oh.
is this number?
Right?
No,
No, those are
That
total.
town
That's not per
portion is
person.
all of the 2-person plan,
Yeah.
97,000
This
is
is
all.
everyone in the 2-person plan, it's not, that's how
Divide
much
that by
just
4
divide by
or
4.
whatever, yeah.
No.
Okay, so that's
Well,
not,
I,
That's not what each
That's not-
individual person in that.
No, no,
No,
Not
it,
all
it,
4.
it
Okay.
comes out
On the
to
bottom,
$25,000 a person, or 20,000.
this little
yeah.
Okay.
microscopic wording
I
down
know it's
here
hard to read, but
is actually the premium for,
Okay,
so right now, a two-person plan per month is $21.46.
2146.45.
okay, so we're
Yeah.
looking at two-person.
25K a year, yeah.
So the two-person plan accounts for the 4 people that we have on it. Like that number there, that's
This number.
that
90
66,000 a year. Well, yeah, I'm looking at the green for next year, sorry, at the bottom.
Okay.
So that 66 is all 4 people.
Yes,
But we
All
don't have
14
anybody on the
person.
single, or that's
Correct.
anticipating that we would have one person on the single?
Correct.
Okay, so it's one person on the single, that's the 4 people that we have on that, and that, okay. So I was playing with the percentages then.
But that, Joy, that number on the bottom there, the 66571,
Yeah.
that does not include the rate increase that's gonna come in October, November. It hasn't been published,
Right.
so that's where
That's using-
I guesstimated 6%.
Right. And it'll
So you wanna
likely
increase that by 6%?
Yeah, that's, I did just
That's
for
a-
a talking point,
guesstimate.
because when I researched this last year, it looked like it's
That's
about a
about what it was
6
gonna
to
be.
8% increase annually. So, I mean, that's in the ballpark. So that would bring our total cost to about $270,000 for the green plan and $400,000 for the yellow plan for next year. It's about a 20% increase above this year's budget.
Okay. So. Alright, so looking at the green plan for next year at a 6% increase, that would bring it up, yeah, about $500.
So it'd still be less than.
It would be about it would be approximately, instead of the 254, it'd be about 269.9, so about 270.
Right.
So an extra $15,000. So yeah, still significantly less than.
Then the 396.
Yeah.
It's a $126,000 savings
Yep.
over the yellow plan. let's say.
Yellow versus green.
Yellow
Yeah,
versus green.
Yeah, yellow versus green.
Right. Okay, so school care though. This is the other.
this is Cigna.
Okay.
This would be us joining SAU 13, which is Madison and Tamworth teachers and system. I didn't have really the good opportunity to find an apples to apples on it. I hadn't
Right.
got that far. We were gonna do some more research, but what I brought to the selectmen was just kind of, this is where I'm at with what I found. Just skimming it quick, looks very similar to this kind of the things that we already offer, or are offered. The pinky thing about this one is they're a July to June plan with the school system, so we would have to come up with some solution on how to handle
Make the
the first 6
transition.
months,
January,
right, that
right.
transition into a different kind of a
That's because they deal with schools.
school most often.
Yeah.
So you're looking at like an 18-month budget, just to get into line with them. Pretty
Yeah,
much,
yeah,
right?
I see what you're saying.
Yeah, 'cause
But
they're-
they do, but actually though, school care, this November, will have their rates that will start in next July.
Okay.
So at town meeting, we would already know, just like Health Trust, we would know what that new number would be in July versus,
You're gonna review this in some detail, are you?
I was gonna try.
I mean, this is a
But-
lot, this is a lot to absorb.
No,
Well,
it's a
there's
very
not-
complex issue.
Well, I
There's not-
understand
Very-
that,
yeah,
I've dealt with it before.
Yeah.
And this would be changing, you know, everyone's from Anthem to
Provider.
Cigna, potentially providers could change.
Yeah.
I'd have to teach everybody how to do everything the new way.
Yeah,
you know?
yeah, right.
So there's a, yeah. So
Well,
anyways,
then you also want to make sure that everybody's provider accepts this. Because you don't, especially if someone has a medical condition that they have they're
Sure.
going to somebody.
Right.
Is this, is this school care network driven, do you know?
I'm not sure.
Yeah, they're Cigna,
Cigna.
right?
Cigna?
Yeah, they're
Which is a
Cigna.
network, it's,
It's national.
So-
It's
you have to
pretty
go to
big,
their,
Their providers.
their providers, okay.
but- yeah. They're pretty big, but
Yeah,
I don't know
was
how
gonna
they
say,
are up here.
There's, I would think that if SAU 13 is using them, then predominantly they have providers in the area that accept this insurance, so.
Yeah, I think before we make any changes, we would obviously like we said, check with the employees and see if that would mess up their doctors.
Mhm.
If we,
Certainly
if
worth
we
looking at. I mean,
look at
just-
it more
Well,
closely.
Sure.
I agree with you, changing over is, I've been through that twice, I don't wanna see it again. It's brutal. Cause you're gonna miss something, you know, one little thing that's gonna just,
Well, that, yeah.
And I know, that's my concern, is make sure we
well,
understand.
it's very,
yeah.
it's complicated.
Very, yeah. No, and if you compare the yellow, green, the green looks very lucrative, right? You know, wow, we can save a ton of money, but what is, you know,
At what cost?
and what are
To
we
the
actually
employee.
saving?
When do we get the rates?
Mid-October for Health Trust, November for school care.
So when you get them in the middle of the month, can you notify us? So we get that ahead of I assume we're gonna meet on this after that, right?
Well, we have
You
a
have two
meeting every
meetings in October.
I know,
Yeah.
but
You start having two.
When,
If
what's
you-
the, no, finish it.
I just don't wanna wait 3 weeks to get information.
No,
It's
I'm
already
thinking,
here.
what's the deadline, Linda, to sign a contract for 2025 healthcare?
It's,
You know, what's the open season or
You know,
whatever, you know, they call it?
I don't remember if there, what the deadline is, cause every year we continue,
Yeah, I know, but if we, you know, if we wanted to switch from yellow to green or,
Right,
you know,
right, right.
vice versa, right?
yeah, I wanna say,
What-
we'd have into December. to-
Okay, just,
I was gonna
I
say,
don't know what
you
the
have, like,
timeline is.
by
yeah.
mid-December.
I'd say. I
If you're
think
switching
that-
plans within the same provider, I don't think you could.
That's
It
easy.
shouldn't be
That's
much of
the
an
easier
impact, I
thing.
No,
would
it's
think.
Right,
Yeah, it would be switching from Anthem to Cigna. That would become more, not complicated necessarily, but it's more paperwork driven.
One thing we'd have to look at is at the HSA, at the 50%. If we go with the green plan, this is one of the numbers we're gonna have to look at, since there's gonna be higher copays or higher deductibles, we're gonna spend more on the HSA
Well,
as well, I assume.
Maybe.
Maybe.
We don't
When-
obligate more. We don't
Yeah.
necessarily spend it.
Yeah.
Right.
Because
Yeah,
when-
it depends.
if you look at the
Yeah,
second,
okay.
or
well,
that-
cause when we started this in 2019, we took half of the deductible and put it in a line, and I think, I wanna say we put like $18,000
Yeah.
in the deductible line, in that HRA line.
yeah.
And if you look that first year, we spent next to nothing, really.
Spent $2,200.
You know, and then, so then I took a little bit more out the next year, and a little bit, and this year, I mean, I wanna, well, you can see the average, we don't spend more
You're
than
not spending that
5,000.
much, no more than 5,000.
You know, and I, like I was saying, everybody seems generally healthy, and I can't imagine that those numbers would change significantly,
Okay, no, I just wanna make sure we
Yeah.
look at the impact on
you
the.
know.
Because right now we pay the first
Half.
$500 for an individual and the first $1,500 for a family. And that would go up to $1,500 for an individual and $4,500 for a family, but you're not even coming up.
We're not
Coming
even close to
close.
We're
that.
not even coming
yeah.
up to that 1,500, so.
No.
No, right.
Yeah, and I did the math on 5% versus 7% versus 10%
This
versus
is-
13%. Yeah, and the cost, you know, for an individual, say going from 5 to 10%, that's obviously a doubling what their contribution is, so they'd go from, well, alright, so again, looking at an individual, assuming there's one individual, their percent that they would contribute would be, go from $4.99 to, what is it, $8.75 or whatever it is, so like $4.30, so let's just say $4.37 to $8.35, so that's obviously doubling what they would pay, per year, so going from paying $400 a year to, you know, $450 to $900 a year. And the taxpayer, like, I don't know, it doesn't amount to much.
That's what I was thinking.
Well,
what-
that's what, I mean,
Yeah.
and so we need to
Just like you were
define
to say, it
much,
doesn't-
we need to see the numbers
Yeah.
specifically. If it only, like we said, if it only amounts to, I mean, you're looking at $400, a change of about $450 for a single person, there's one single person, that's fine, but where it comes to the
year.
family, there's 7 of those entities, what does that come to? And how much difference does that make per
Yeah,
year?
that's-
But those,
So, but we don't have to do those numbers tonight, we
Yeah.
can take a look at that.
Yeah, it's all speculating now until you actually have the rates anyway.
right,
Right.
if you don't have the number, you just,
Okay. Right now, just this year, yellow plan, it's $12,170 divided by 7. It comes out to $1,700, $1,738 a person. So, yeah, if you went to 10%, it would be, you know, you'd be
$3,400,
$3,500,
$3,500 a person.
per family, yeah, per employee. So-
Plus increase that by 6% because
Yeah,
of the
So-
escalation in the costs, so. So you're looking going from $1,700 to probably
I know.
close to $4,000. Maybe, about
but
3,800.
then we're talking next year, if we stick with yellow plan, we're talking almost 400K.
Correct.
So, 4K out of 400K really isn't a big deal, right? I mean, it's a decimal point. So, but that's gonna be one of our largest budget items. I mean, the way we're going the next few years.
Right.
If we keep seeing, like this year, a 20% increase.
Right.
And that's not an exaggeration, that really could happen.
Well,
Absolutely.
this year, I mean, just strict budget numbers, we're gonna have a 20% increase
Right, and
this year.
yeah,
Yeah.
that's based on 6%.
Yeah, that's a 6%
So if it's actually
inflation
ends up
rate.
being 8%, you're talking
You get 8
20,
or 9.
23
Yeah.
or 24.
No, I mean, it's gonna get very expensive very quick. I think the number I came up with, was
Cost of medical
last year
care.
by 2030 or 31, we were gonna be up over $800,000.
Yes,
I forget the numbers
Yeah.
that we put together last
it
year.
was significant.
It was, you're gonna hit $1 million by 2032, 2033.
Within,
Yeah.
like
Yeah.
8 years, we
Yeah.
were gonna. Okay, so for Joe, you're gonna at least give us what those numbers
Yeah,
look
just-
like, so that,
Kinda add on and go,
yeah,
okay, if we went
to 7%.
7, whatever,
Yeah.
here's what it would be.
7, 8,
I'll just do
10.
kind of a quick sheet.
Yeah, absolutely, if you
And,
don't mind. Okay, and then if you send it to us in between, like when you get it done, it's not like get it done by the end of the week kind of thing.
I'll
No,
be working all night on this
Right.
guy.
I was
No.
just gonna say tomorrow morning.
Tomorrow morning, what time?
Yeah.
8 o'clock?
no. If in the next 2 weeks or so,
Oh.
you could have that to us, it would be
Get our
helpful.
heads around this.
And then Linda, if whatever other information you can divine out of the school care piece.
Yeah.
And come up with a similar sort of sheet, like maybe make it pink or something, or
Yeah.
purple or
Is Signal well
whatever.
received, by the school employees?
I don't know, actually, now that you say
I
that,
don't
because
know
that
much
Tuesday night,
about these plans.
Adam had said that he'd like to try and maybe talk to a couple of people who
Yeah,
are
I'm just
in that
curious
network
how-
and see what they think of it.
What
too.
it-
Well, that's why I wish Sarah had been here, cause she could
Yeah.
hopefully maybe,
I don't know anything about these plans, that's why I'm asking.
I don't either.
How well the employees like it.
Well, I mean,
I don't think anybody ever truly loves their healthcare plan.
No, ours, my prescription co-pays and everything like doubled this year, it's crazy. They switched providers.
Oh, yeah.
What used to be, $20 at Walgreens, 40 now. I know, it's out of control.
All right, well,
Right.
we have public comment, is there anybody that's moving on?
I think
There is no
I
public.
think that guy over there wanted to say
The
something.
guy
Right.
wanted to say something.
So then, if there's no further business, does anybody else have any closing comments? No?
I move to
Elwin, you've
adjourn.
been very quiet over there.
Yeah, so I'm listening.
Okay, so Rick has
Move to
moved to adjourn.
We
Do
need-
we have a second?
Second.
Elwin seconded. All in favor say aye.
Aye.
We are adjourned at 9:02 PM.
I think this could
Okay.
be a divided vote.
Did we solve all the world's problems tonight? or
No,
something?
but I think
Then some.
we're getting ourselves fairly well prepared for when it comes down to the hard numbers.